Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, Metro Manila and 4 nearby areas return to a modified enhanced community quarantine status following the appeal of medical frontliners for a 2-week timeout. Also, Malacanang insists the government did not fail in its COVID-19 response, even as the government's or the country's coronavirus cases surpassed the 100,000 mark. And a lawmaker wants a Senate probe on the status of the country's health system and if there is a master plan to overcome the health crisis. Senator and Philippine Red Cross Chairman Richard Dick Gordon joins us live. It's day one of the re-implementation of the Modified Enhanced Community Quarantine, or MECQ, in Metro Manila and 4 nearby provinces. Government placed these areas under stricter quarantine rules as coronavirus cases continue to surge. Yet on Monday, Malacanang insists that reverting to MECQ is not an admission of failure in its COVID-19 response. Medical experts say while the MECQ will not necessarily flatten the curve, the 2-week break can help government recalibrate the current health strategy. A senator also filed a resolution that aims to look into the state of the healthcare system, which he says has been, quote, dangerously stretched to its limit. Amid medical staff shortage, a group calls for higher salary, proper equipment, and free testing for nurses to attract thousands that are unemployed. This development as the health department sets up teams to fill in for the sick or exhausted frontliners in Metro Manila. Carolyn Bonkin has the details.
Nurse Nico Oba received another bad news at work today. 4 patients died of COVID-19. Despite the hospital doing its best to protect them, health workers are also still catching the virus. But Nico still carries on to perform his sworn duty.
Kahit alam namin na pwedeng manganib ang buhay namin, nandyan pa rin kami araw-araw pumapasok, 24 hours, ang iba nag-36 hours. Kasi alam namin na kailangan kami ng mga pasyente. Kailangan kami ng bayad.
As of Saturday, over 5,000 health workers got COVID-19. 38 of them died. Almost 1,500 had COVID in July alone. Public hospital nurse Jamie De Guzman says nothing much has improved despite the government's promise to add more health workers. She says the hospital she's working at is using industrial-grade face shield. Broken facilities such as unrepaired elevator makes it hard to transfer patients to another floor. And the biggest challenge, people with coronavirus concerns flocking the hospital since June.
We are catering for like 150, at least 150 a day for COVID swab. Imagine nyo na lang po, for a 12-hour shift na ganun kadami yung darating, 3 lang yung nurses at yung doktor 2 lang. And totoo yun for the doctor from the community.
She said their hospital ward and laboratory are overwhelmed. Her fellow nurse, Pauline Beauty, says some were not even given enough time to go on quarantine after their weekly shift ends. The shortage of doctors, nurses, and other medical frontliners is stretching the healthcare system. The health department recently said they're receiving fewer applications. But Filipino Nurses United President Maristela Abenujar says around 250,000 nurses remain unemployed, but many are not heeding the government's call.
Hindi kasi nila nakikita ang tunay na malasakit ng pamahalaan para doon sa mga currently employed. So, nandoon yung kanilang kaba o takot na baka sila ay imbis na makatulong ay maging biktima, maging pasyente ng COVID-19.
Abenohar says the government should come up with clear and concrete medical interventions to address health workers' concerns while under the modified enhanced community quarantine, such as providing them with medical-grade equipment, free COVID testing every 2 weeks, higher salary, and hazard pay. She said a nurse should only be assigned to 3 to 4 COVID patients instead of 12.
Pangulong Duterte, huwag mo kaming sabihan na magpulis na lang kami dahil mababa ang aming sweldo. Ang mga katagang iyan po ay patunay na hindi nagkakaroon ng malasakit sa kalagayan ng mga nurses. Imbis na kami ay i-encourage mong maging pulis, dagdagan mo ng budget ang ating pamahalaan para makapag-hire ng dagdag na mga nurses.
Health spokesperson Maria Rosario Vergeres said substitute healthcare teams will relieve hospital staff in Metro Manila. They'll also identify infection clusters and strengthen contact tracing measures. Caroline Bonkin, CNN Philippines.
Welcome back to The Source. I'm Pinky Webb. Our guest today is Senator Richard Gordon. Senator, welcome again to the show, sir.
Hi, Pinky. Good morning. Hello.
Good morning, sir. Maraming salamat po sa inyong oras. Let me start with this, Senator. All right. Was the government, Senator, right in its decision to impose MECQ in Metro Manila, Bulacan, Cavite, and Rizal? Or should government have heeded the call of the medical community to revert back to the strictest status of ECQ?
Well, I think there was a reaction from Malacanang. They went into a modified ECQ. And I think we're going to have to expand after that to make sure that there will be a respite for all the frontliners. Nahihirapan na sila. Ang dami na rin may sakit. There are a couple. There's one dying right now as I speak. And a lot of the doctors are beginning to not report for work. There's a lot of medtechs that are also COVID infected. And so there really is a big problem, and that we really have to act. And I believe that the timeout that they're asking for is well worth taking.
You know, Senator, how do you feel when you hear the words from the frontliners such as pagod na sila, burnt out, not just physically but mentally? And sabi nga, it's time to really refine our pandemic control strategies. You know, I ask you that, Senator, not just a lawmaker, but because you're also the chairman of the Philippine Red Cross, very much involved in the fight against COVID-19.
Yeah,
sir.
we're all exposed. Actually, I've had to be on quarantine because a lot of my staff and a lot in the Red Cross, and also even in the Senate, who go to the Red Cross have been affected, and a number of our medtechs have also been affected. And I feel that really a lot of people are exhausted. It's a very terrifying illness, and although the death count is not high, one death is one death too many. So certainly, hindi lang sila ang natatakot, yung mga pamilya nila natatakot, siyempre, no? Like I have Kathleen Sanen, I spoke about her in my speech yesterday. For the last 2 months, she's been fighting for her life, and the Red Cross has given her 64 bags of blood already, and a lot of other people have donated blood, and they had to take a machine from MKTI called ECMO to add to her breathing and to make sure that her lungs have been affected. So really, I feel very, very sad, and we really have to make sure that we are more cerebral in our actions, na dapat pinag-aaralan lahat, at we cannot have a knee-jerk response insofar as what is happening to our country is concerned. There's got to be a cogent master plan,
Senator,
in making sure it happens. Yes, go ahead.
Yeah.
Yes.
And I wanted to ask you, Senator, as I mentioned a while ago, you've been very involved in this. What are we doing? Number one, sir, what are we doing right? And then number two, what are we not doing right?
Well, first of all, we should have tested right away. That's why the Red Cross stepped into the fray right away. Testing is the most important thing. Dapat talaga ihiwala yung mga may sakit, at saka dapat malaman natin. Pangalawa, pag nakita natin yung mga may tama ng COVID, dapat nagkulang tayo doon sa contact testing at saka doon sa contact tracing. medyo hindi masyado ang enforcement. Ang sabi nga ng mga doktor, optional lang dun sa mga local governments na hanapin nila yung mga tao at malagay dun sa mga isolation at saka matulungan. Marami silang sinasabi na dapat ginawa yung ang case finding and isolation. Tapos nagkamali tayo pala sa rapid test. Mabuti nagdesisyon na ang presidente na gamitin na yung PCR because yung rapid test is toss coin yun. 50-50 lang ang chance mo doon. No? At hindi talaga recommended yun. Tapos yung sabi nga ni Benji Magalong sa mga LGUs, only 4 out of 600 LGUs have capability na makakakuha. Tapos yung mga workplace safety, yung mga public compliance with self-protection, tayo rin sa mga kababayan natin, tayo mismo, hindi tayo nagmamask, hindi tayo nagdidistansya. Kung hindi ka, at the very least, kailangan you follow distancing. The COVID virus is transmitted like that. No? Tapos talagang overwhelmed na talaga yung ating health system. Impaired nga eh. Kulang na yung mga hospital natin, yung mga isolation natin, nakapila sa PGH, 16 na tao para makapasok doon sa ICQ. At karamihan ng beds sila, almost 80% are occupied, yung mga isolation beds, no? 80% of total ICU beds in NCR alone are already being used. So talagang mahihirapan talaga tayo pagka hindi natin ayusin yung mga bagay na yan. So marami ng hospital na nagsara o temporarily sa kanilang COVID capacity. St. Luke's, Makati, National Kidney, pati NKTI. Ilang beses na nagsara yung RITM.
Yeah.
Ilang beses na nagsara itong lung center, pati mga private hospital nagsasara. So talagang we are in a tizzy right now at dapat makulong natin dito sa Maynila. Lalo na nakakatakot, tabi-tabi ang mga bahay dito at ang mga tao hindi sila makapag-isolate sa bahay nila dahil isang bahay, isang kwarto lang. Yun na yun. Wala na. Lahat sila natutulog sa isang lugar. Talagang maghahawa-hawa.
So, in essence, Senator, from what I'm understanding, you're saying that the stuff that we're doing right now came a little too late. For example, sir, I'll give you one example, yung pong pag-quarantine. Hindi ho ba nung una sinasabi mag-quarantine kayo sa bahay and then months after, ang sinabi pag wala kayong sariling kwarto at wala kayong sariling banyo, kailangan kayo pumunta sa quarantine facility. So that major shift, sir, that could have spelled a big difference.
Yun ang sinasabi natin. Pag na-trace ka na, halimbawa, nagkaroon ng COVID sa bahay mo, dapat ang ayuda doon susunod. Hindi lang hiniwala yung tao. Ngunit yung mga tao doon na iwan, dapat tetestingin yun kung kaya. Kung hindi kaya, dapat huwag mo nang papalabasin. Bigyan sila ng pagkain para hindi na sila lalabas at magkakalat. Kung may magkaroon ng tama, kailangan kunin rin sa isolation. Pero anong gagawin mo kung ang mga isolation areas mo ay puno na? At makikita mo lahat nagkaroon tayo ng tidal wave ng tsunami na dumating ng mga OFWs. Ang requirement doon, lahat itetest, lahat dadalhin sa mga kwarto sa hotel. Yun ang naging concentration ng ibang panig ng gobyerno. At nakalimutan natin yung home front.
How do we proceed from here, Senator? Because as we mentioned a while ago, sinabi niyo po lahat ng mga hospitals, puno na po, they're not accepting patients. Makati Med, St. Luke's, Quezon City, BGC, you have the Medical City, you have NKTI, sir, and many more. Hospital ng Maynila, nagsara din po. How can we move forward now?
Well, unang-una, lahat pasok muna sa bahay, walang lalabas. At gamitin na lang ang telepono kung talagang may emergency. At they can call DOH, they can call the Red Cross. Nung una pa lang sinabi na rin namin noon, nag-uusap kami ng Secretary of Health ng araw na dapat meron kami mga hotlines. Kaya tayo meron mga sa Red Cross yung 1158 para halimbawa kung tatanong yan, sir, may nararamdaman na ako, inuubo ko, yan, i-advise yan. Tatanungin ng lahat ng kanyang sintomas, tutulungan ng mga doktor natin, ng doktor ng DOH, diyan ka muna sa bahay. Meron ka bang kwarto? Kung wala kang kwarto at medyo lumalabas, tawagan mo kami uli at dadalhin ka sa isolation. Yung pa yun na marami pang isolation beds. Kung ngayon, nagsambulat na yan, talagang kailangan maghanap tayo ng isolation areas na paglalagyan. We just have to bite the bullet and create doon sa sa China, natatandaan nyo, nagtayo sila kaagad ng malaking hospital at hindi lang natin alam, marami pa silang tinayo na gano'n. Yung hospital na tinayo nila, 1,000 beds, 1,600 beds in 10 days. No? Nagagawa talaga yung kaya naman natin yun kung talagang pagtutulungan. Pero palagi ko, aabot tayo doon na kailangan magdagdag tayo ng isolation. Ginagamit na natin yung Nueva Drug Center at palagi ko marami pa tayong makukuha na lugar sa Metro Manila and near Luzon para magkaroon tayo ng isolation.
Senator, some of the recommendations of the medical community stated that number one, there is a healthcare workforce deficiency. That's nothing new, hindi ho ba, Senator? The government responds by saying we need to hire more healthcare workers, numbering 10,000. My question is, sir, in reality, really, sabi po nila, kulang na kami. Kailangan na namin ng karelyebo. Government says we'll hire thousands of healthcare workers. Sir, how possible is this that they can hire thousands of workers at the soonest possible time?
To begin with, 6 out of 10 people will die without ever having seen a doctor in our country. Ganyan tayo kakulang. Second, ang daming doktor at nurses na nagpunta na sa ibang bansa at doon nagtatrabaho. So talagang hirap na hirap ang mga doktor natin. But that's the way it is. Kailangan talaga mobilize natin, pati yung mga retired doctors siguro, yung mga hindi na nagpa-practice pero may medical degree. Diyan tayo ngayon mag-mobilize. In fact, ginagamit ko nga yung constitutional provision, Article 2, Section 4, if I'm not mistaken, and declare yun dapat pagka in times of war and national emergencies, the government may call on all citizens to render personal, military, or civil service. No, so I'm not saying that we can do that. We should do that right away. No, but in the meantime, we have to really repair our broken health system na ngayon severely under the hill. Talagang kung hindi natin a-actionan ang kailangan gawin, kaya nga nag-time out, it's a huddle para mag-usap-usap. Kaya nga tinawag ko kahapon, in-author ko yung resolution kahapon na we have to call a time out, bring in all the patients, bring in all the doctors, and to the Senate or to by way of virtual hearing, so we can hear, not only, we know what their side is, ang kailangan natin, anong gagawin natin. And so, meron na mga, you cannot solve it by just throwing money. You really have to have a master plan. Anong gagawin? Sino nga isolate? Yung ambulances, saan natin dadalhin? Yung mga tao na kailangan na talaga. Yun ang nangyayari sa atin ngayon.
Senator, it's as if we need to go to the fine print of what we're going to do, the nitty-gritty.
Definitely. Di ba dapat mayroong central clearing area tayo na kung saan dadali natin yung mga tao sa isang lugar na napagkaisahan na, no? Saan tayo pupunta? Hindi pa identify. Diba, Pinky, if somebody calls us, uy, sinisipon ako or something, baka may COVID na ako, nakakuha ka ng test, mukhang may positive ka, ang tatanungin mo, saan ako pupunta? Pupunta ka sa QI, puno ang QI, pupunta ka doon sa ilang mga isolation centers na puno na rin. So, anong gagawin ko ngayon? Yun ang kailangan. Yan yung kailangan ngayon, yung dapat may hotline na magsasabi sa kanila kung anong gagawin. At really, if we don't pick it up right away, and that's what we're doing right now, huwag na tayo maghintay doon sa hearing. Tanungin natin ang mga doctors kung anong pwedeng gawin. Dapat talaga pahinga muna. Pagka hindi ka nagpapasok muna, nagsara ka muna, and hindi masyadong marami ang pupunta sa hospital, maka-isolate muna. And sometimes, like in the 1917 pandemic, the disease will die. It will get tired, and then it cannot find a host. That is the whole point of the isolation.
Right. All right. Senator Gordon, we need to take a very short break. We'll be right back. You're watching The Source on CNN Philippines. I'm Pinky Webb. Our guest today is Senator Richard Gordon. I want to talk about this resolution of yours, Senator. So it's calling on the Senate Committee of the Whole to probe the status of the health of the nation and government's COVID-19 response. First question, sir, is when can this happen? When will this happen?
It's already happening. Today we're meeting about PhilHealth, kaya lang may 3-day notice. Sabi ko sana wag na hintayin yung 3-day notice kung makakapunta na yung mga doktor pumunta na. I think Wednesday we will be able to call a hearing already or the very latest Thursday. But tingnan mo sinabi ko kanina, dapat magawa na yan yung parang meron kang command and control system, no? Na talagang yun ang mag-address ng referral system for both public and private na yung capacity nila ay hindi ma-overwhelm. Parang kang nagsasalansan dyan, parang meron kang booking, meron kang front desk to sa hotel, no? And then kailangan rin, marami tayong kailangan gawin sa mga hospital, no? Talagang antiquated, sinusulat pa yung mga orders ng doktor. Pero ito yung mga gagawin natin sa hopefully malapit na panahon. Yung one patient, one record, pairali na yan. Hindi yung 5 ang doktor kung minsan, maghahagilap pa ng record yun para malaman lahat ng ginagawa. So, kailangan one patient, one record. Dapat makikita ka agad yung mga doktor kung ano kailangan gawin. Telemedicine, yun ang sinasabi ko kanina, na dapat may command and control system ka na may mga doktor doon para pagka gumagalaw yung mga tao at nanghihingi ng tulong, magagawa natin. Isang suggestion ko, napakasimple lang, COVID first aid. Sinabi ko yung kahapon. Yung COVID first aid, halimbawa, meron kang kaibigan o meron kang partner, magtatanong nga kayo, how do you feel today? Meron kang checklist na sasabihin natin na ikaw ba sinisipon, ikaw ba inuubo, ano nararamdaman mo? And then, truthfully answer that. No? Pagka meron ng ganon, then you call the command and control system para katulad. From the very beginning, we had that. Pero mukhang nawala mukhang hindi na ganun pa na gusto.
You know, Senator, I spoke to Senator Nancy Binay last week and yun din halos yung kanyang sinabi dahil kapag meron daw may sakit at kapag tumawag daw sa siguro sa City Hall or sa kanilang syudad, sasabihin na tatanungin saan sila pupunta. Tapos sasabihan daw sila na puno na yung mga quarantine facilities and then they don't know where to go. So definitely a command and control system, sir, might actually work.
That's what I'm saying. We do that in the Red Cross. Kung talagang kailangan kunin doon lang pupunta sa ospital. Kasi ayaw natin anong nangyari dito, binangga ng mga tao yung hospital, kaya na-overwhelm ang hospital. Tandaan mo, meron pang ibang tao na may sakit. Yung nagpa-dialysis, yung may chemotherapy, yung kailangan operahan. Marami yan. At ito pa isang problema. Bago sila mag-opera, o bago sila magtumanggap, kailangan magpapatest muna yan. Kaya hindi masama magpatest. Kung kaya ninyo magpatest, magpatest na kayo. Para kung sakalang may emergency, hindi kayo basta makakapasok sa ospital. Kailangan isa-swab muna kayo at kailangan hintayin yung test. No? Hindi lang naman tayo ganyan, buong mundo. Pero dapat, alam talaga ng tao yung mga hotlines sa Red Cross 1158, no? Ang hotline. Sa Department of Health, meron din silang hotline. I'll get to you in a little while. Pero dapat gamitin yon ng mga tao.
Yung pong test, Senator, even for people who want to take the test, yung swab. And pag meron pong Viber message na lumabas, and I remember that, it says, these are the prices. And from what I saw, it was Red Cross that was cheapest. At that time, sir, it was at 4,000 pesos. Yun pong 4,000, marami na pong mahihirapan na bayaran yung 4,000, sir.
That is why, Pinky, meron kaming niraise na pera, almost 19 million, para yung mga mahihirap talaga na hindi covered ng expanded coverage ng PhilHealth. Isang nakakatagal dyan yung PhilHealth. Hindi, at saka ang DOH, hindi nila malaman kung sino i-cover. Matagal ko nang inaangal yan. Hindi naman kaya ng gobyerno i-test lahat, di ba? So yung may kaya, yung 4,000 na sinasabi nyo, mga walk-in yon. Pero yung mga mahihirap, yung talagang exposed, yung mga buntis, yung mga doktor. Yung mga doktor, tinetest namin yan. Ang magbabayad dyan, PhilHealth. Hindi naman pwedeng walang cost yun dahil ang bayad doon, 3,500. Pero kung ikaw, tayo, may kaya tayo, 4,000 ang masisingilin para naman tuloy-tuloy. Like now, naghihintay kami ng darating na products sa China. we get the swabs and the reagents, and they have to be delivered. In the early days, Pinky, I have had to charter a PAL flight to get all our machines, all our testing kits, no? So, until dumating na rin yung C-130, nakakatulong tayo. May mga tumutulong rin iba mga kaibigan, nag-o-offer para magamit yung kanilang aeroplano para makakuha. Pero isang damakmak na problema ang haharapin mo pagka papasok ka sa China. Maraming dadaan pa sa DFA, dadaan sa kanilang DFA, dadaan sa kanilang airports. Ay, naku, napakahirap. Pero huwag natin isipin yung mahirap. Kailangan lang talaga gawin natin paghandaan lahat. We have to predict and plan and prepare and practice. Kaya yun ang sinasabi ko sa Red Cross, may 4Ps kami. Kung ngayon, talagang ang labanan ngayon, parang kumbaga basketball, no huddle offense. No, wala nang huddle dahil mayroon na tayong nakahandang memoryado natin kung anong gagawin natin. And even with those plans, kita nyo, Amerika, pinakamataas.
Kumbaga, right.
Kaya talagang,
it's almost like a proactive approach.
Mabuti rin na ang mga doktor nagsalita na sila at that's the big signal na dapat pinapakinggan. Noong araw pa sinasabi nila na dapat pakinggan natin. That's why I have been saying, ako naglagay doon sa lono, all frontliners must be tested by with the Red Cross, and this must be paid for by the government. Nilagay natin yan. Dahil kung at kailangan may plano yan. Ginagawa naman nila yan. Minsan sa mga hospital natin, 14 days mag-duty, 14 days hindi mag-duty. Ngayon, iniiklian na yan. 7 days mag-duty at 2 weeks na hindi mag-duty. Kaya lalo tayo nadadarang. Pero kailangan gawin nyo. Kundi, pag nawala ang mga frontliners natin, nawala ang mga doktor, nawala ang mga nurses, wala na tayong protection. Wala na tutulong sa atin na lalaban sa disease.
Senator, I have 1 minute. Okay, I have 1 minute left, Senator. Just 2 questions I wanted to ask you. What are your thoughts on some people saying that there's too many military men looking into and addressing this COVID-19 problem at tila kulang, allegedly, ng mga experts, health experts to really address this pandemic, sir?
Tawagin natin ang mga health experts, mga scientists, yung public health, magsama-sama lahat yan. Yung mga epidemiologists, dapat yan ang kinakausap. Yung mga military sa implementation, kaya nila yan. Dahil sanay sila doon sa give me an order, I will follow it. No? Pero to prepare a plan, hindi iba ito sa giyera. Itong giyera rito, hindi mo nakikita. Ang nakakaalam, scientist, kailangan may testing. At kung hindi magte-test, hindi nila malalaman masyado kung ano gagawin. Doon na malalaman lang natin pag na-test na. And then what do we do? That's where the planning must be complete. Kung wala noon, delikado.
All right. And okay, Senator, one last question. Of course, months ago, 14 senators already asked Secretary Duque to resign. And when I looked at the senators who signed this, you were not one of them. What are your thoughts now? Do you believe still in the leadership of Secretary Duque, or would you be one of those senators now who would want him to resign?
You don't change horses in the middle of the stream. That's very conservative because mangunguha ka ng bago. Now, kung inaakala ng mga tao, ng presidente kailangan palitan, you have to change. Pero they better get a good one who's gonna replace. Siguro dapat may transition yan para magkaalaban muna, no? Yung iba may mga axe to grind nagagalit sa kanya, kalaban niya dati, kasama siya ng isang kalaban ng tao. Ang daming ganun And ako, I want to be fair. Pero sa akin, you want to change the Secretary of Health? It's not the Secretary of Health. Lahat tayo. We don't follow the restrictions. We don't follow distancing. We don't follow masks. We don't follow washing of hands. Kasama yan. And when you look at our numbers and compare to the other countries, this is not patting him in the back. I'm not patting him in the back. Marami siyang kakulangan, no? Pero dapat it starts with us. And then when he answers questions, medyo hindi siya direct kaya marami nagagalit rin. And I support that na kung when the Department of Health no longer has the capability to be believed and to be credible, maybe it might be time to go already.
Okay, thank you. Senator Richard Dick Gordon, sir, take care.
Thank you very much, Pinky.
Thank you, and thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.